Okay, so I have a huge public service announcement to make regarding COVID-19. There's a lot of talking and education about wearing masks to prevent this, and I agree with that. However, there's not a lot of information for people once they get this bug. So, if you do get diagnosed with COVID-19, there are some things you can do at home rather than just sitting there waiting to see if you're one of the lucky ones who's able to fight this off, or to see if you develop shortness of breath, difficulty breathing, and increased heart rate, things like that, and have to seek medical attention. There's things you can do at home once you receive that diagnosis before it gets worse. And the thing that I'm really trying to help you prevent is COVID pneumonia. So COVID-19 can develop, this bug is SARS-CoV-2. The SARS-CoV-2 bug causes the disease COVID-19. That disease can develop into COVID pneumonia. That's the big thing we're trying to prevent. COVID pneumonia is what's causing people to end up on ventilators. My background, I'm a licensed teacher. I'm also a licensed EMT, and right now I'm in respiratory therapy school. I graduate in May. I'm in my second year doing critical care rotations in the big hospitals here in Massachusetts. I work in one of the big hospitals here as an ER technician, emergency room technician, and we're seeing a lot of COVID. But the thing you can do at home, and that's, not just wear masks. We can wear masks, but we can also, once you get this diagnosis, we can also take some steps at home to prevent COVID pneumonia. So on this picture, you'll see some lungs here with fluid in the bottom, and it has like some cartoon-like COVID viral type spots. That fluid in the base of the lungs, we can help remove that at home before it develops into pneumonia. And the ways we can do that is through using gravity and something that we call postural drainage. So you'll see this cartoon here on the bottom, right here. This is one postural drainage position where you put pillows under your belly and use gravity to help clear the fluid out of the bases of the lungs. So this picture on the top here shows a lot of fluid in the bases. This position here with the pillows elevating the bases of the lungs, it allows that fluid to flow from the small airways in the base of the lungs into the larger airways and out. You could cough it out at that point out of the trachea. So at home, instead of just sitting there with a diagnosis of COVID positive, start taking steps to prevent COVID pneumonia. You need to use these techniques when you are sleeping. Another way to increase oxygenation is you've heard on the news, I'm sure, of them proning patients. You don't have to wait until you're in the ICU to do that. You can do that at home, even if you have a very mild case, because when you're laying on your back, you have blood pooling in the base of your lungs and the oxygen toward the top of your lungs, and you want to rotate so that you are on your belly, which we call prone position. It will lift the heart and the great vessels off of your lungs and allow that mixture of blood and oxygen so that we can oxygenate your blood and allow gas diffusion. So provide oxygen and get rid of CO2. You can do that at home. You can prone yourself, you can sleep on your belly. You can also do these postural drainage positions to help move the fluid into the larger airways and out. You can cough it out. The more junk you get out of your lungs, the better. You would be surprised, even if you don't feel like you have any fluid in there, you would be surprised when you start using the postural drainage positions how much junk you actually get out. And that's what we are advocating for. I highly recommend you do something instead of just sitting there waiting with the diagnosis to see if it gets better or worse.